Parimala Devi Kumara Swamy, who is an associate registered nutritionist of UK, United Kingdom since 2008 and has over 20 years of experience in clinical nutrition and dietetics. Ma'am is the founder and consultant of Parim's Nutrition, and she has worked across various leading hospitals in United Kingdom and Coimbatore. This list just goes on. She's a media spokesperson, invited speaker to national and international conferences, and she has published many articles in international journals. Ma'am, we welcome you, and I'm sure it is going to be a delighted session for all of us.
Talk about the biological etiology behind the obesity is like, nowadays brain-gut axis has been given like so much importance, and also like gut microbiota with the other additional factors. So in biological, the genetics, pre-genetics, brain-gut axis, prenatal determinants, pregnancy and menopause, neuroendocrine conditions, medications, physical disability, gut microbiome, and viruses. And also like there are various environmental factors influence the cause of obesity and the behavioral aspects too. So when we talk about the comprehensive weight management program, it comprises of nutrition, physical activity, cognitive behavioral therapy, and medication surgery when indicated. So we are going to talk about the lifestyle intervention. So it has nutrition, physical activity, and cognitive behavioral therapy. So in nutrition, there are so many factors should be considered for the treatment of obesity, in addition with the psychological aspects and the physical activity part. So the obesity guidelines is talking about the comprehensive lifestyle intervention should be given for at least 6 months for an overweight or obese person. And also like it should contain all the 3 components like diet, physical activity, and behavioral therapy delivered by health professionals like registered dietitians, exercise specialists, and psychologists. So in first 12 weeks, 0.5 kilo to 1 kilo per week should be the weight loss induction. And during the 6 months, the individuals or a patient should receive 14 on-site individual or group treatment sessions. Frequent contact is critical for a clinically meaningful weight loss in obese patient. So the medical nutrition aspects, definitely a registered dietitian should be take care of the person for medical nutrition therapy, and it should be an extensive nutrition assessment, diagnosis, intervention, monitoring, and evaluation targeted at the intrapersonal level. So assessment include quite a lot of information, the background about the patient, and the dietitian should do everything to find the proper dietary intervention. And also like the health indicators should be taken consider while you're seeing the patient. So it could be like, in the example I have given like 0 to 10 scale about all the things like energy level, stress, sleep, hygiene, everything. So everything should be in a row before treating the patient. And also nowadays, there is so much of importance given to motivational interviewing, which is nothing but the patient-centered counseling, which enhances the positive behavioral change, which promotes the healthier body weights and body composition for the obese patient. And also, if we look into the principles of motivational interviewing, we should express empathy, avoid augmentation, develop discrepancy, resolve ambivalence, and support self-efficacy. There are 5 A's of obesity management. We should ask, assess, advise, agree, arrange, and assist. So we should, if we go periodically with this, then definitely the patient is going to get benefit and we are just going to be happy. So the evidence-based, if we see that we are just prescribing so many dietary advices to the patient. We are trying this and that, but there is quite a number of dietary patterns and the method which have been like evidence supportive, RCT based. So those are like low calorie diet, very low calorie diet, very low carbohydrate diet, MD with energy restriction, high protein with energy restriction, meal replacement or structured meal plans, decreasing sugar sweetened beverages, and portion control. Whereas the eating frequency, time of eating, breakfast consumption, we don't have enough evidence. And to talk about increasing fruits and vegetables and low glycemic index, the RCT evidence non-supportive. When we look onto the principles of healthy nutrition, definitely we should limit the unhealthy food, ultra-processed foods, and also like ultra-processed meat, which is going to increase the insulin resistance So the inflammation is going to cause the base for all the metabolic disorders, the chronic disorders, starting from obesity, overweight obesity, abdominal obesity, type 2 diabetes, dyslipidemia, hypertension, everything. And also energy dense foods, high in calories should be limited, and the beverages too. And also trans fats and excessive sodium should be avoided. And among sweeteners, sucrose and saccharin may increase body weight compared to aspartame and sucralose. So we should limit all those things. So we should encourage the healthful proteins, which is going to decrease the ghrelin, the hunger hormone, and increase the satiety hormones, such as like, PYY, glucagon, like peptide 1, everything. So the fats, healthy fats is going to be very helpful to reduce the insulin resistance here. So we are supposed to give particularly importance to MCT and omega-3 fatty acids, vegetables, green leafy vegetables, again, legumes, the protein part. Complex carbohydrates over simple sugars should be taken care. It's just because, again, insulin resistance plays a major role here, and high fiber foods, the fiber is going to be like very much helpful. It's just because in gut microbiota, the fiber is going to get fermented and it's going to produce the short chain fatty acids, particularly the acetate and butyrate is going to stimulate the production of fullness hormones, which is going to be very beneficial for the obese patient. And also, like many dairy products, particularly calcium decreases the cortisol hormone, and also like it's going to reduce the visceral fat accumulation. So we should encourage all these things, and also like we should encourage the reading labels rather than the marketing claims. And also like we have to consider a safe and effective nutritional therapy, and which is very feasible and appealing for the patient to the patient. And also like we should encourage the negative calorie balance to achieve and maintain the healthy weight, and consider the following points like eating behaviors, meal patterns, cultural background, traditions, food availability, time constraints, financial issues, nutritional knowledge and cooking skills, medical conditions potentially affected by the nutrition plan. When you talk about the nutrition therapy, of course, the focus is going to be on caloric manipulation of the 3 macronutrients, carbohydrate, fat, and protein. So low calorie diets, particularly with restricted fat diet and restricted carbohydrate diet, has proven a very good result for obese. And also very low calorie diets, that is less than 800 kilocalories, and the medical supervision is recommended. And definitely it should be a short term, and definitely we should go back to the low calorie diets once we finish the low calorie diet. And studies have talking about the calorie restriction reduces the blood pressure, lipids, glucose, induces weight loss in obese, and lowers, and also additionally it's going to be lowers bone density, muscle strength, and BMR. So when we are giving the very low calorie diet or a low calorie diet, we should consider all these points and we should take care of this. So initially it's going to be give a large weight loss. So we can just use it for a short while, and we can just continue, moving on to the other patterns. And low carbohydrate diet, it's going to be like in 6 months, it gave like 8 kilos weight loss, and at the rate of 1 year, 6 to 7 kgs. Low fat diets also like, very promising effects. When we look into the dietary pattern, MD therapeutic lifestyle diet, DASH, ketogenic, Ornish, paleo, vegetarian, or vegan, intermittent fasting, or like any fasting diet, commercial diet programs, they have given promising effects on obesity, and it has been advised by the Obesity Society of Medicine. So Mediterranean diet is definitely not a diet, but it's a pattern which consists of a plant-based foods, comprises dietary fibers in large quantities. So the satiety is going to come, which increases the fullness hormones such as cholecystokinin and GLP-1 and peptide Y, all those things. And also it's rich in MUFA, so it is going to be like improving glucose metabolism and increase the postprandial fat oxidation, which is very much needed in obesity. So MD is good for, improving all these factors. And also like therapeutic lifestyle change diet is a low fat meal plan variant. So it's being utilized for, a lipid clinical trial. This is also a good diet for obesity. Ketogenic diet, of course, if you are a planner of a ketogenic diet, then you can just go ahead, and you have to follow all the principles of induction, ongoing, pre-maintenance, maintenance, all phases, in a restrictive manner. Ornish diet is nothing but a vegetarian nutritional intervention with low fat, refined sugar, and animal protein. It is more than a lifestyle than an eating plan. We can use that as well. DASH diet primarily to treat high blood pressure. So we can just use the same diet for obesity as well, but it is going to, reduce all the heart related problems. And also there will be some weight loss and decrease in weight circumference has been proven. And Paleolithic diet, yes, you should be very careful in planning that, and it can be, planned by a registered dietitian. And vegan diet is very much promising nowadays, but we should take care of the micronutrient deficiencies. It's just because, all the B12 sources have been removed, particularly we are just removing all the non-vegetarian. And this vegan diet contains many variants. So whatever we are advising the patient is following, we can just do that. And it has promising effect, and also weight change has been seen in this, but the vitamin and mineral deficiencies should be taken care in this. Fasting diet, it's quite popular nowadays, but we should follow this, thinking about the positives, pros and cons of this diet, and we can just recommend. So there is nothing harm in doing this. And also the problem creators, when all these high levels of insulin, leptin, cortisol, estrogen, neuropeptide Y is present in the body, obesity is going to stay with the patient. And same, low ghrelin, low peptide YY, low GLP-1, low CCK, cholecystokinin. So if we are taking care of the diet part, particularly if it is as we saw in the principles of the nutrition, if we follow that, these hormones are going to get corrected, and it's going to beneficial for both. And also behavioral changes should be taken care. So self-monitoring, motivational interviewing is necessary. Structured meal plans and meal replacements can be used. Portion control is very much important. Goal setting and problem solving, because they will just come with so many problems. And also we have to talk about the slow rate of eating, cognitive restructuring by a cognitive therapist, contingency management, but for some extent we can just support the patient in dealing with social support, stress management, stimulus control, and cue reduction. We should take care of all these points, apart from a therapist. And also we have seen all the common barriers in the patients. So all these, when regulated in an obese patient, definitely they are just going to get the weight reduction, and also it would be beneficial for long term. So the physical activity, definitely it's going to be a very helpful tool for weight loss. So it should be very much assessed for current physical activity level, readiness, potential need for medical testing and evaluation. The physiotherapist will take care of this. Mobility, fitness, potential equipment needs or modifications, and the patient should agree. And also they do have their own expectations. So we should fix according to their need as well. And also potential adjustment of medications, optimal default and backup plan should be there. Sleep and hormones, definitely these hormones are going to be very much affected during the less sleep. So 7 to 8 hours sleep should be advised to the patient, so that the cortisol is going to be very normal. If the cortisol is going to be high, it's going to produce the insulin resistant, and the whole mechanism is going to get affected. And we can just advise the melatonin supplement, or we can advise some food as well. We have to take care of other hormones as well. There are so many, all these hormones are going to be secreted during sleep. So sleep should be a lifestyle helper for managing the obesity, and we have to advise them to treat the stress level as well. So when we think about the diet, not a one size fits all for obesity treatment, and also it's not only fully on dietitian, but it should be a multidisciplinary approach. Teamwork should be there. So thank you very much.
Thank you.